Americans are filling fewer prescriptions for opioids. In fact, a new study shows that the number fell dramatically last year, but the crisis is far from over. Meg Terrell has the details.
Prescription painkillers like OxyContin have played a major role in the opioid crisis, and public health officials have increasingly been calling for changes in the way they're prescribed. According to a new report, those measures appear to be working. The volume of prescribed opioids in the U.S. peaked in 2011 at about 72 pills per American adult, up from 22 pills in 1992. New data today from the Iqvia Institute, an industry researcher, show that decline accelerated last year, reaching an average of 52 pills per adult in this country.
This is a significant drop. We think it's important to see that and to recognize that some of the programs, perhaps many of the programs that have been put into place in the past year or two seem to be having an impact.
Health insurers and pharmacy benefit managers have been implementing new regulations to try to limit overprescribing of opioids, such as restricting new prescriptions to just 7 days and monitoring prescribing practices more closely. They've also lifted hurdles for accessing so-called medication-assisted treatment for opioid addiction, and prescriptions for those medicines, such as buprenorphine, have been on the rise.
What we're reporting is almost doubling in the number of new patient starts using one of these medication-assisted therapies, going from about 42,000 patients a month at the beginning of 2015 up to 80,000 a month at the end of 2017. So a quite rapid increase in the use of those medication-assisted therapies.
Unfortunately, though, prescription painkillers are not the only source of the problem, and both heroin and stronger synthetic opioids like fentanyl have overtaken prescription drugs as the biggest causes of overdose deaths, according to the CDC. But overdoses from all forms of opioids were increasing through the end of 2016. And the reduction in availability of prescription opioids may have had some complicated effects, according to public health researchers.
It's generally good news that prescription opioids have declined. It's been accepted that there's been overuse. I guess unanswered question, you might say, is whether some of the policies that have been in place have led to other unintended effects, whether it's transition, and one of the main ones that people are concerned about is whether there's been a transition to heroin and other forms of opioids because of the reduction in prescription opioids. And I think that is an unanswered question and something people are looking at. That, I think, is the concern.
So still a lot of work to be done. For Nightly Business Report, I'm Meg Terrell.